Hello everyone, drberkkkaratas. What tests should be done initially for individuals with erectile dysfunction and what should we look for? We will talk about these. This is a very important topic because many people can start treatment for erectile dysfunction directly without undergoing any tests. These are very valuable tests for detecting many diseases. Now, we know that 75% of diabetic patients experience erectile dysfunction. For this reason, it is essential to... One of the first tests to be done for the person is fasting blood sugar and hemoglobin A1C. Fasting blood sugar shows the condition for that day. Hemoglobin A1C shows the condition over the last 3 months. Therefore, it is very important that both of these tests are conducted. The second is the elevation of blood lipids. Well, in 70% of patients with elevated values, there is erectile dysfunction. It is essential to check cholesterol, triglycerides, HDL and LDL, which are commonly known as good cholesterol and bad cholesterol. The tests need to be conducted and the ratios of these to each other are also quite important in terms of erectile dysfunction. Another factor is hypertension. 30% of these patients have erectile dysfunction. Therefore, even if the patients have never had any issues related to blood pressure until now, their blood pressure should be measured or monitored. Cardiovascular disease is present in about 18% of patients. I have explained this in many previous videos. Let me explain this again. Patients who have had a heart attack, when looking back, it's the past. We know that within 3 to 5 years, 20% of these patients have a history of erectile dysfunction. Or let me put it the other way around. 20% of patients with erectile dysfunction, meaning 20 out of every 100 patients or 2 to 3 out of every 10 patients, can be considered candidates for a heart attack within 3 to 5 years. This is especially true for those over 50. So right now, this is not a book of information, but I believe it will become a book of information in a very short time in the future. Erectile dysfunction equals being over 50. Heart examination. So cardiology concentration. It needs to be, I especially recommend this to all my patients. Hormonal disorders are very important. In 15% of patients with erectile dysfunction, there is low testosterone. In 13%, there is high prolactin. And in 3%, there can be low or high thyroid hormone levels. Of course, these hormones need to be at certain levels of low and high. There doesn't seem to be much of a problem with minimal decreases and increases. But these also definitely need to be checked in the first stage. Lastly, of course, blood disorders, meaning a complete blood count. For example, if a person is anemic or commonly known as having low blood, erection is already something related to blood. So it's related to the blood flow to the penis and the accumulation of blood in that area. If a person is anemic, meaning they have low blood volume, of course, their ability to achieve an erection will be reduced. This condition can be corrected with a very simple treatment. That's why a complete blood count needs to be done. Why am I explaining all this? I've explained this before. I'm explaining it over and over because no of erectile dysfunction and receiving no treatment, no diagnosis, without understanding the reason, based on recommendations from friends or some medications or herbal substances they saw on the internet, medications or some substances. The number of people using herbal substances is quite high. I mentioned this in previous videos. Please don't do these. Initially, these tests need to be done. Did you go to the doctor and were these tests not done? Please alert your doctor. Being an informed patient is also very important. Your doctor may say, I want to have these tests done, but in general, we urologists request almost all of these tests. I would be glad if you could be informed about this matter as well. Thank you.